All right, my last video I talked about personality disorders. Now I'm going to talk about mental illness in the mental health while I'm discussing mental health with you guys. But let me add this because I didn't do it in my last video. Personality disorders, it's very hard to treat. There's not a pill or a medication that you could take, and therapy often it doesn't really work that great, right? So just keep that in mind. Now with mental illness, there are different therapies that work, and there's definitely medications that can work. Because if, let's say you suffer from depression, right? Depression can be treated with like SSRIs, things that change the serotonin, or like if you're schizophrenic, you can be given medication that will that affect like the dopamine receptors in your brain and things. So there's medications absolutely that can help. And so I worked for many years in a psychiatric hospital, and I've seen all kinds of mental illnesses and things. And when I worked at the prison too, it's important to know that place, mental illness is rampant. I mean, there's tons of people that are very sick and they're talking to themselves, talking to unseen others, so this idea that innocent, not guilty by reason of insanity, a person is not always gonna. You could be mentally ill and very sick and still not win an NGRI case if that's what that individual pleaded. All NGRI means is that they were so sick at the time of the crime that they did not even know right from wrong. There's a lot of people that are depressed or schizophrenic and they do know right from wrong. And guess where you go if you get convicted? The penitentiary, right? You know what I mean? NGRI, you have to be like, you were just so out of it, so sick that you couldn't tell right from wrong. And it cannot be drug induced. That plea that people like to take cannot be something that happened because you were out of your mind because you were on drugs at the time. The nurses will come by and they give medication. And I just don't think mental health or mental health it's not there, you know what I'm saying, in the prison. There's nurses will come by and give people medication, but there's people that really need help. If we're going to change something else besides like working on getting air conditioning inside of the Texas Department of Criminal Justice, we have to work on getting better mental health treatment for those that truly need it. And one of my biggest pet peeves would have to be when people say, "Oh, I'm depressed." And are you truly depressed, or are you just sad at the moment? Like, here's an example. Are you depressed? If I gave you $1 million, would you still be sad and depressed? Well, in that case, if you are, then yeah, you're depressed. But if I gave you $1 million and took away your problems, then guess what? You were never depressed. They kind of use like here's another one that I can't stand that people misuse a lot. They're like, "Oh man, I'm so addicted to Cheetos." Are you really addicted to Cheetos? What, are you still in your grandma's TV to go pawn it to buy Cheetos? Or do you just really like Cheetos a lot? You know what I mean? I want to tell you, I think that language is one of the most powerful things that we can use. So I think it's super important to just think about what we're saying before we, say it. I make mistakes and misspeak all the time on here, especially when you're recording, and I'm not going to re-record everything just because I misspoke, or used maybe the wrong word in a sentence, but to do it habitually and over intentionally again, yeah. Anyway, different tangent, but mental health, mental illness, and personality disorders in prison, man, it's a super depressing thing, and it needs to change. That's what needs to have some reform take place.